Good morning, Dr. Campbell.
Good morning.
Thank you very much for joining me. So my name's Sushila, and I'm a partner in the Clinical Negligence Department at Barlow Solicitors, and we're one of the firms on the Cauda Equina Champions Charity legal panel. I've asked Dr. Campbell to join me today to just run over some of the psychological issues related to people who have Cauda Equina Syndrome. So I'm going to hand over to you, Dr. Campbell, to introduce yourself, and then we'll start.
Good morning. My name's Dr Campbell. I'm a consultant psychiatrist. I'm here, my consulting room at Priory, Roehampton. I've been a consultant psychiatrist for more years than I care to remember, probably about 35 now, or since the old king died, as we say. I have seen quite a few patients with Cauda Equina Syndrome, some of them via Maya's firm and other patients that I've seen independently. And I'm aware what a devastating condition it can be. I've also got friends who are neurologists that I meet with to discuss the condition, and they sometimes send me people. I think one of the, well, there's a lot of issues here, but it's the suddenness of onset of this condition. And the main thing is this devastating effect, if things are not picked up in time, which you're aware of very normal functions, bodily functions, sitting in the loo, going to the loo, you don't even think about that, and suddenly that kind of takes over your life. And those very basic things is all consuming. And working out how to do that, sometimes evacuating your bowels and all that kind of stuff. You didn't even think about that before, and suddenly it's a big deal. And then, of course, sexual side effects and the mobility side effects are enormous.
So in your experience, the impact of having Cauda Equina Syndrome, and because of the nature of the symptoms it affects, is the sort of root cause of further problems for that individual.
Yeah, that's one aspect, or a major aspect, but also in people who the diagnosis has been missed initially, and because of that it has proceeded to Cauda Equina Syndrome, and there's often huge resentment to furious anger about what's happened, and that of course is the mother of depression for many people. So you've got a perfect storm there. You've got this physical condition, and then they missed it, and I'm left like this. And then there's the famous postcode lottery. That depends on what was going on in that often A&E department at that time, which is incredibly variable. And then other people around, if they pick it up to treat it, and so on. And then following on from that, what are the resources and efficiency of that particular area to managing this? Have they got the right surgeons, and then have they got proper physiotherapists? So if you've got that in place, it's going to help. But from a psychological aspect, of course, understandably, if you're left with this disability, a significant number of people are going to be unhappy and then become depressed. Is there any psychological support? Are there good enough therapists and psychologists in that area who know about this sort of thing? It's important with these kind of medical conditions that the therapist understands a bit about the neurology of it all and understands the consequences.
That's not necessarily always available, though, is it? No. So I suppose
it's incredibly variable. Yeah. And even in the private sector, I mean, we have kind of access to any therapist we want, sort of, but there's not many of them, even the people I know, who would know about this kind of thing. That's a pretty select thing. So there's often I say to this to patients, you have to push to get the right help. Look, I'm struggling here. I really want help. And it's difficult to do that sometimes if you're down in the hole and you're depressed, to jump up and down metaphorically and say, look, I need help. And it's a natural part of depression. People get depressed. I can't be bothered, feeling worthless. And I'm at the same time guilty, and all that negative, self-critical anger, emotion is swirling around. I can't be bloody bothered. I'll just bloody lie here.
And that's one of dealing with the physical symptoms as well.
I think that we know that with physical conditions, those who are fighters are going to do better psychologically. That there's a tendency, and this is not a criticism of people with Cauda Equina, you know, if you're laid up, there's sometimes a tendency to just lie in bed, stay at home, I'll give up, I can't be bothered. But those that I see that do better are saying, like, I want to get moving in whatever way possible, whether it's with a wheelchair or electric wheelchair, sometimes they can do a bit of mobility. The more I can do and get out, that's going to make them feel as if they're fighting this bloody thing. Because the ones that I see that are worse take to the bed, just lie there, and then they get weaker, and then they can't mobilize, and they get pressure sores and all the rest of it. So it's a bloody tough. I mean, it's some sort of test of people's spirit, and then of course that depends if you've got supportive family around. Sometimes they get young children who are very demanding, which is, you know, even more stressful. So it's unfortunately puts quite a bit onto the patient themselves. Suddenly out of the blue, this thing descends upon them, and they have to fight it. But I do see those that do that have a better outcome.
So your experience is that with good psychological support, whether that be CBT or even a support group or something like that.
I think the psychological supports are very much, you know, eclectic therapy. We're looking at the negative thoughts plus aspects of your daily living, and very often you'll find physiotherapists who are extremely good at that, who are upbeat. Come on, let's do this. They're very practical people, physios and occupational therapists. They have a kind of, you know, go-getting kind of attitude, which is, and then it may well be that antidepressants can assist you. I think I say that there's very few conditions that people with depression I treat that antidepressants are kind of a magic bullet. They will assist you along with therapy. My patients who don't have Cauda Equina, all of them see a therapist. Some of them have antidepressants, but modern antidepressants in the right dose, sometimes in combination, can help people's mind lift a bit in order to start to feel better, and in order to motivate them, behavioral motivation, to do the kind of things I'm talking about. And I know, to repeat myself, it's bloody difficult. You've had this thing often that they've cocked up at the hospital, and you're left in this state, and some people think, I can't be bothered. But really, believe me, the people I see that do well are those that are coming out and say, right, we're going to fight this. I'm not sure there's been a study of that. I don't think there's been a study of that in Cauda Equina, but other conditions, very famous study on breast cancer many years ago, the women that were fighters and wanted to do something about it and change their diet, they do better. Their survival rate's better. And it's kind of commonsensical. The same thing would apply to the people's neurological conditions.
And do you feel that there is merit in, for those people who find a support group helpful? Do you think that?
So absolutely. Sorry, I should have gone on to that. I mean, you're there with this condition, and you're on your own, and I'm the only one in the world. Oh God, help me! I'm miserable. But the power of speaking to people in the same condition and sharing experiences and say, well, this is what helps me, particularly if it's somebody in the group that's, you know, got a bit of kind of oomph about them. Nothing to do with Cauda Equina, but I'm an addiction specialist. I see the people that do best with our alcoholism are those who go to AA, not because of the spirituality. We're all in this together, lads. We've had a terrible time. We're trying to be sober. This is what I do, and when I'm feeling down. And so if you're in a group, then you'll often find somebody that you can call when you're in a miserable hole, and maybe your family aren't listening to you and things are getting on top of you. And also the groups are well of latest information and treatments and things. So it's very, very, very helpful, because that tendency to be isolated, just lie there, stare at the telly or just stare at nothing, is really, really not good.
And I suppose the advantage of a group of people who've got the same condition is that they've all got similar symptoms, and so the embarrassment factor is less, because
and they will end up.
About.
It's not very funny, but you know, they'll end up making jokes about the evacuating their bowels and catheterizations and all that kind of stuff. How useless the doctors are and the physios and stuff. So you know, so it's not all doom and gloom.
Yeah. Okay.
Shared adversity.
Yes.
Is very powerful.
Yeah. Okay, well, I think that's a really brilliant insight into the impact of the Cauda Equina psychologically and what treatment options there are available. So thank you very much for today.
And I just say to people, you've been dealt a bad blow, but keep fighting it.
Thank you. Thank you, Dr. Campbell.